How much are we budgeting for the vaccine next year?
There is 8 billion in the DOH budget, Your Honor, and in the program's appropriations.
Yes.
And that is up from the original 2.5 billion in the NEP. And there is another 10 billion set aside in the unprogrammed fund, Your Honor.
Don't we also have a 10 billion under Bayanihan too, unprogrammed?
Yes, Your Honor, I think so. I believe so, yes.
Diba? So if we extend the validity of that, that's already 28.
That's right. That's right. That is much improved over the original figure in the NEP, Your Honor.
Now, question. How much is it to inoculate 50 million? What is the cost to inoculate 50 million?
300.
Ang Pfizer, according to Pfizer, the cost is roughly $20 for 2 doses. I'm sorry, $40.
2,000 pesos, around 2,000 pesos, Your Honor. Yeah, what I heard is Secretary Galvez mention 300 pesos. I think that's the AstraZeneca one. So I guess we're doing the calculation. It would be 50 million times 2,000 for the
at
Pfizer.
1,000, it's 50 billion.
Right, that's correct, Your Honor.
Okay,
so,
now, the cost to distribute. You know, the Pfizer, you need negative 90 degrees.
Yes, I heard you need at least, 94 degrees Fahrenheit, 70 degrees Celsius, Your Honor.
Correct. Okay, negative. Yes. So the distribution cost will be probably twice more than the cost of the vaccine.
I'm not sure if that cost of the cold chain has been factored in, Your Honor,
Correct.
to be honest.
Correct.
Yeah, I did not handle the DOH budget, but I will check on that, Your Honor.
Correct. And that's why I'm bringing it out now here, because I think that is the most important portion of the budget for next year.
You're absolutely correct, because I was reading an article in Time magazine where once the vaccine leaves the cold chain, it loses its effectivity, Your Honor.
Correct. And chances are we will all need 2 doses. Okay?
That's to the expense, Your Honor.
Yes. And to have herd immunity, what they're saying is that you need at least 60% of the population, so that's 60 million.
Wow, or probably more.
Right? Okay.
Yes, Your Honor. Yes,
now,
Your
here
Honor.
we're talking, now, I look at it this way, no? And, I've looked at some of this material as well, no? So, since the younger people are less susceptible to the virus, and we have a young population, okay? So, kung 18 pataas, voter age pataas, that's roughly what? 54 million. Okay, at 1,000 each, that's 54 billion. If you include the logistics, it's probably 108 billion and counting.
Yes, Your Honor.
Okay.
Yes.
Now, I read somewhere an article that the government was willing to borrow $10 billion, thereabouts, to inoculate our population.
Sorry, I missed the last point, Your Honor. I
read an article
that you need.
That's Secretary Galvez and I think Secretary Dominguez in the paper said that we're borrowing, I don't know if it's from ADB or from somewhere, a multilateral agency, $9.5 billion to $10 billion. I don't know if it's a program loan, but it's tied to vaccine.
We will get details. We will solicit details on that, Your Honor. We don't have them at the moment.
Okay, now, shouldn't we provide the appropriation, if not in the program, since we're borrowing the money anyway, in the unprogrammed fund of at least 100 to 150 billion? Because that should provide confidence to the people.
Yes. Subject to the amount, I think, I philosophically, I would totally agree with you, Your Honor. Subject to the amount, Your Honor.
Yeah, meaning to say that if we tell the public that we are serious in addressing this pandemic, that's the best thing that we can do. No amount of infrastructure, no amount of any, except for relief to families, no amount of economic spending will turn the tide unless you provide more confidence.
Absolutely, Your Honor. Absolutely.
I mean, look at it this way. We are having now a budget deliberation first in our history, okay? And we are not present in the Senate. We're conducting these budget deliberations via teleconferencing. And lucky for us, we have the ability to do so.
Yes, Your Honor.
Okay? So can you imagine those who cannot do this and can't work and can't get paid for their labor, o yung iba naman kailangan lumabas, sa palaran na lang, kahit magkasakit, para maghanap buhay. Now, if we can tell them that at least in the Senate version, okay, that we are providing the amounts necessary to inoculate our people, especially our workers, 18 and above. We're putting sufficient funds. Kahit na utangin pa yan, at ilagay natin sa program, shouldn't that breed confidence? Kasi
Definitely,
kung kulang,
yes.
Kung kulang ang i-appropriate natin, babalik sa atin ng executive, uy, kailangan pala ng cold chain, kailangan ng facilities na ganito, kailangan ng ganyan. Baka too late na naman. In fact, we should have been placing orders already for the vaccine, di ba?
Yes, definitely. But in fairness, I think the IATF officials are in conversations or communications with the vaccine manufacturers, Your Honor.
Yeah, correct. No, I'm sure they're doing their job. All I'm saying is that we should do our job as well.
We agree with you there, Your Honor.
Okay, and provide the funding. Put it in the budget.
Yes, I think we agree with you, Your Honor, and we must provide that flexibility, Your Honor, because given the highly uncertain nature of the times we are living in, Your Honor.
That is correct. So thank you for that. So let me leave it at that. And I thank the chairman for his response. And again, more or less, you're talking about minimum, just to make a manifestation on that again. 100 billion. Minimum. And remember, how much have we lost already to the pandemic?
82 billion. 82 billion was the figure given.
No, that's the calamity. That's
yes,
the three.
For COVID.
For COVID, on the economic front, 1.8 trillion.
1.8 trillion, yes, Your Honor.
Okay? That does not, kung walang pandemic, we could have gained another trillion. Is that correct? Can you ask Secretary Chua if that's fine?
If there was no pandemic, we could have...
So today our GDP is roughly 19 trillion. Without the pandemic, dapat 2 to 2.1. 20 to 21 trillion na dapat tayo.
Yes, Your Honor. Yes.
Okay. So we lost 1.850, 1.9 trillion. And in terms of opportunity loss, how much did we lose? Isn't it another 1 to 1.8 trillion?
Assuming normalcy, yes, Your Honor, around that much, yes.
Ergo, we lost 3.6 trillion. We could have been...
Yes, Your Honor, assuming normal times, Your Honor. But
correct,
as we said, these are not normal times. So
Correct. So what is 100 billion to address the problem?
It appears to be a drop in the bucket, Your Honor.
That's the point. Now, failing to do so, how much do they expect to gain next year? What is the growth rate? 6% from a low base?
6.5%, Your Honor.
And how much is that in terms of value? That assumes that there is no second wave.
Around 1.8 trillion additional, Your Honor.
Yeah. From a low base.
Yes, from a lower base, Your Honor.
From a lower base. In fact, isn't it that based on these numbers, it'll take about 2 more years to get back to 1919?
Yeah, that's I think on the optimistic side, in fact, Your Honor.
On the optimistic, take 2 years, Okay?
Yes, Your Honor.
To get back to 1919. Okay? And that assumes that their projections are correct.
Yes, Your Honor.
And spending only 20 billion for a vaccine. Okay?
And nothing for the
chance. We will have a better chance of hitting their 6.5 or more if we appropriate and execute properly the inoculation of our population with 100 to 150 billion more in the budget for the cost of the vaccine and the logistics. Think about it, hindi biro yung logistic na yan. To inoculate 50 million people, you have to inoculate 150,000 people a day for 1 year.
Yes, it's a huge logistical requirement.
It's a huge logistic. Kaya sabi ko nga, kailangan ng vaccine czar na kung pwede, may Justice League pa. Magkakasama na lahat. It's a Herculean task.
Absolutely, Your Honor.
So, now, let me move on, Mr. President. Would you agree with me that we have been underspending in health for the last few decades? Clearly. And this pandemic has showed us na talagang we were underspending in health, especially in the countryside. Let me ask the chairman, who's representing the DBCC here, no? Okay. How many new hospital beds are we building next year?
We're retrieving the figures, Your Honor. I know there is a budget for health facilities enhancement.
Facilities enhancement yan, equipment yan, hindi bagong hospital bed yan. In fact, what is the budget for capital outlay? Sige, health facilities enhancement.
How much is capital outlay under the DOH, Your Honor?
Yes, how much is that? Yes. Incidentally, I'd like to thank the chairman for adding to the vaccine, to the health enhancement, and to the many good features of the committee report of the Senate. So let me congratulate the chairman on that.
Thank you very much, Your Honor. In answer to your question earlier, it's 5.9 billion, Your Honor, for HFED, health facilities enhancement.
Yes. Meron din saan program, di ba?
Meron din po saan program to.
Magkano saan program? 10?
4.5, Your Honor.
4. So total nga pala is about 10. Okay. Yes. How much is the total capital outlay next year? Magkano total capital outlay ng buong budget next year? Isn't it a trillion?
1.1. Around 1.1 trillion for infra, Your Honor.
Okay. And we're spending only a measly 0.5% for health in terms of capital outlay. How much are we spending?
Your Honor, we're spending 216.6 billion for the DOH and the attached corporations and hospitals like the Lung Center.
Yeah. No, we understand that. The question is, I understand that, and most of that is PhilHealth.
The bulk, yes, about 70, about 1/3, Your Honor, is PhilHealth.
Yes, and then more pa, because the operating budget of the PhilHealth, they would have another 30 billion or 40 billion collections.
Yes,
okay,
Your Honor.
So, but that's not the point. The point is, how much are we spending for infrastructure capital outlay? Because that takes care, most of that is on the demand side.
GDP.
I'm talking about the supply side now, the ability for us to treat. You have health financing as part of it on the demand side.
Yeah, we're spending around approximately 5% of GDP for infrastructure, Your Honor.
No. A trillion budget is our national capital outlay. That's roughly 5% of GDP.
Around 5.4, Your Honor, yes.
Yes, okay, 1.1 trillion Okay. And in health, how much is it, capital outlay? Di ba 10 billion lang or half of that?
It's 11.4 approximately.
Okay,
billion,
so that's the point I'm driving at, Mr. Chairman.
Yes,
we're spending of the capital outlay only 1% for health.
Yes, Your Honor. I suspect there's a bit more if we include some of the items you are pushing for and our colleagues are pushing for, which is the capital outlay for some of our state universities and colleges. But it's only a drop in the bucket.
That's the point. So I put a crisis to waste. All countries in the world today are doubling their spending on health too, because it showed everyone that the world has been underspending in health, especially the Philippines. You ask any former secretary and they'll tell you the same thing. These last few months, I've been in several webinars talking about the economy, recovery, so on and so forth. And then part of the panelists would always be a former Secretary of Health. And everyone will tell us that we've been underspending. Okay? And it shows in next year's budget also. Now, I don't expect to correct all of that in next year's budget. I'm just taking the opportunity to make this manifestation and to put it in the records of the Senate so that if not next year, the following year, maybe we can start next year, but then in the following year, we need to make improvement in our healthcare spending, particularly on the supply side. In fact, no new hospital bed will be created, especially at the local level. Our priorities this year or for next year should be different. Like I said, mas importante mo ba yung item na yan than what is necessary, let's say, for infrastructure in health or for the pandemic, for the vaccines?
No, Your Honor,
Kasi
that would be the main. The vaccines and what you mentioned for health-related expenses
Yes,
would be
correct.
the main priority. Should be
Correct.
the main priority,
Kasi,
Your Honor.
yes, kasi binigay na rin naman yun sa uniform personnel, binigay na rin sa teaching personnel. Di ba? That's the point I'm trying to make.
Yes, Your Honor.
Okay?
Yes, Your Honor.
And that's based on their study already. Ito, bigay na natin ito. Ito baka hindi pa kailangan. So if we are to create I don't think we'll be creating an agency next year. Huh? I think first and foremost is let's address this pandemic. Okay? Let's provide assistance to those hit by the calamity.
Yes, Your Honor.
Di ba? Then we can fully recover.